I want to talk about another patient case that I had that really emphasizes why these people on GLP-1 medicines need actual care and not just access to these medicines from these pill mill places out there. Patient in her mid-30s was on 15 milligrams of tirzepatide, Zepbound, and was doing fine, pretty stable. She had a history of hypothyroidism and a few other things, but had recently gained 20 pounds. The only advice she had gotten was basically, hey, you need to figure out how to exercise and eat fewer calories. If you know the literature behind Zepbound and tirzepatide, people don't just all of a sudden gain 20 pounds. That doesn't happen. Is it possible she was getting a bad batch of the Zepbound? You know, some things are possible. Did it get hot? No, that's not what was happening. When talking to her, she was constipated. That can happen on Zepbound. And just feeling tired overall. She didn't have any specific spot where she felt she was gaining adipose tissue or fat tissue. All it showed was 20 pounds on the scale. For me, this sounded like fluid, not like actual adipose or fat tissue. There are a few things that could cause excessive amounts of fluid gain, things that are really bad, things like heart failure, kidney failure, and that type of thing. But with her history of hypothyroidism, I wanted to look at that further. When you looked back, her labs seemed to be stable on the medicine like 6 or so months ago. But based on her history, I was like, is her thyroid all of a sudden not regulated anymore? So we went ahead and checked the thyroid again, and it was completely out of control. Her TSH, the hormone that comes from the pituitary gland that tells the thyroid to work, was elevated, meaning it was telling it, screaming at it, work harder, work harder. And of course, if you have hypothyroidism, Hashimoto's like I have, where it doesn't work so well, it won't work harder. You need to go up in your medicine. With just in a few weeks of adding the T3 or the liothyronine, weight started dropping off, constipation improved, all the other symptoms improved, still not completely asymptomatic. We're increasing the thyroid a little bit more, but this was a clear case of something else that was going on beyond energy balance. And it wasn't even fat tissue. What you see in hypothyroidism is actually fluid gain. And that's what we see, that excessive weight gain happened. So anyway, you can't just assume people are eating more or whatever. There could be something else going on, obviously, with this patient and their history and the changes that happen with this medicine and absorption of certain medicines. You do have to be on the lookout for that. And so a good obesity doctor, or any good doctor really that listens, should be able to pick up on these cues and treat accordingly.